Hi, this is Andrew Phillips. I'm the founder and editor-in-chief of EM Coach, the only artificial intelligence-driven medical education platform out there, coming to you from a night shift. We're going to be talking about this month's EP Monthly question that we have for you. And spoiler alert, right? Again, if you have not seen the question, go ahead and take a look at it and then come back to the video, pause it for a second. But for those of you who have already read the question, we're talking about bed bugs here. And really the question comes down to the crux, which I think we find fairly often in clinical practice, that you come down to the scabies versus bed bugs question. And there are a few features that can help distinguish the two, although sometimes it can still be difficult. But scabies tends to be into the intertriginous regions. You see it classically, at least for test questions, around the areas between the fingers. And the key about the scabies is that they're actually burrowing down into the skin. Now, both of these present with pruritus, but sometimes you can actually scrape and see with the naked eye very, very carefully little bits of the burrowed scabies down into the skin. In contrast, bed bugs are not actually present once that patient is awake and presenting to you. They tend to feed at night and then come back off the host. You also tend to see, classically described, right, as that breakfast, lunch, and dinner, that linear sort of pattern. But I like the photo that we included here a lot because it's not that classic line going straight across, right? It's more of a clump. So whether it's a clump or a line, the idea is that the bed bugs tend to feast within their little area. They camp out, take their bites, and then take off. So you can see on this particular patient, it's a giveaway that you have these little groupings of the papules that are pruritic as opposed to the scabies, which tend to be a little more spread out and evenly distributed. That helps set those apart. Because one of these bugs is constantly on you, inside, whereas the other one is off, eats and leaves, bed bugs come and go, the treatment's very different. So the permethrin and ivermectin are only effective with the scabies because they're actually burrowed down, at least between these two, because they're burrowed down into the skin. And so providing some sort of therapy, whether it's topical or the peel of ivermectin, is actually effective against the scabies. Bed bugs, on the other hand, if they're not actually on you, these medications are not going to be helpful. So it's an important distinction, not only for answering the question, right, for the boards, but also with our patients. We don't want to expose them to ivermectin or permethrin if it's not necessary, right? Just giving them Benadryl for the pruritus is much more helpful and safe compared to these other medications if they don't need them. So look for that grouping or breakfast, lunch, dinner pattern for the bed bugs and look down, try to scrape a little bit and see if you can find any sort of small scabies bugs down inside if you're suspecting scabies instead of bed bugs. So this is Andrew Phillips from EM Coach. Thanks for watching and good luck on your boards if they're taking them soon.